Hello everyone. Today we are going to learn about the bone scapula. So as you know, scapula is a bone which forms part of the shoulder girdle. And as you can see from here, the shape of scapula is roughly triangular. And you can notice that it is a flat bone. So being a flat bone, it is also called by another name, that is shoulder blade. So scapula is a large, triangular and flat bone, and it lies at the posterolateral aspect of the chest wall, and it lies opposite 2nd to 7th ribs. Scapula lies opposite 2nd to 7th ribs. Now coming to the major parts of scapula. Scapula consists of 2 surfaces, 3 borders, 3 angles and 3 processes. The 2 surfaces are the costal surface and dorsal surface. Here comes the costal surface and here comes the dorsal surface. Now the 3 borders are lateral border, medial border and upper border. So here comes the lateral border, here comes the medial border, and here comes the upper border. So once again, lateral border, medial border and upper border. Now coming to the 3 angles, the 3 angles are superior angle, inferior angle and lateral angle. So here comes the superior angle, here comes the inferior angle and here comes the lateral angle. So once again, the superior angle, the inferior angle and the lateral angle. Now the 3 processes. The 3 processes are, one is spinous process, the next is ACROMION and the third one is CORACOID process. Now here comes the spinous process. This is the spinous process. Then second one is the ACROMION. ACROMION is, this process is the ACROMION. ACROMION extends this much. So this much is the ACROMION process. And then the third one is the CORACOID process. And here comes the CORACOID process. So this is the CORACOID process. So the 3 processes, once again, the spinous process, then the ACROMION process and the CORACOID process. Now the lateral angle, so here comes the lateral angle and you can see an articular surface over there at the lateral angle. So lateral angle bears this articular surface and it is called by the name glenoid cavity. Glenoid cavity, and glenoid cavity is also called as the head of scapula. The head of scapula, that is the glenoid cavity. And attached to this glenoid cavity you can find a constricted part. There is a slight constriction attached to this glenoid cavity, and that is the neck of scapula. So glenoid cavity is the head of scapula and the constriction attached to the glenoid cavity is called as the neck of scapula. Now let's see the side determination of the bone scapula. So the first point regarding the side determination is that the glenoid cavity, it should face forwards, laterally and slightly upwards. So here is the glenoid cavity. It should face forwards. Okay. And it should face laterally. The glenoid cavity should face forwards, then laterally and slightly upwards. So holding the bone in anatomical position, and glenoid cavity should face forwards, laterally and slightly upwards. Okay, so considering the position of glenoid cavity, this should be the anatomical position of the bone. Now, next point regarding the side determination, the dorsal surface should face backwards. So here comes the dorsal surface, and the dorsal surface should face backwards or posteriorly. Dorsal surface should face posteriorly. Then the next point regarding side determination is that the inferior angle should face downwards. So here is the inferior angle, and inferior angle should face downwards. Okay. Then the final point regarding the side determination is that the coracoid process, it should point forwards and slightly laterally. So here is the coracoid process. It should point forwards and slightly laterally. So coracoid process should face forwards and slightly laterally. So considering all the points, this will be the anatomical position of the bone, holding the bone in such a way that if this is my bone, so this is the normal anatomical position of this bone, and from this we can understand that this scapula or this bone belongs to the right side. So this is the right scapula. Okay. First of all, we are going to look into the surfaces of scapula. So there are two surfaces, costal surface and dorsal surface. So first we'll see the costal surface. Here comes the costal surface, and when you hold the bone in anatomical position, the costal surface faces forwards and medially. Costal surface faces forwards and medially, and you can see that the costal surface is concave and it is hollowed, and here it forms a fossa, and this is called as subscapular fossa. And when you examine the costal surface, you can see oblique ridges over this surface, and it gives attachment to muscles. Then now let's see which are the muscle attachments that coming in the costal surface. First is subscapularis muscle. So subscapularis muscle takes origin from the costal surface. It takes origin from nearly whole of this surface except a small part near the neck. Subscapularis takes origin from nearly whole of the surface except a small part near the neck, and you know that subscapularis gets inserted into the lesser tubercle of humerus. Then the next muscle is serratus anterior. Serratus anterior gets inserted to the costal surface of scapula. It gets inserted along the medial border of the costal surface. Serratus anterior gets inserted along the medial border of the costal surface, and the origin of serratus anterior is from the upper 8 ribs. The costal surface is called so because it is related to the ribs. It is related to the rib cage, and that is why the name costal is given. Now next we are going to study about the dorsal surface. So here comes the dorsal surface, and you can see on the dorsal surface there is the process called as spinous process, and the spinous process ends in the acromion. So the dorsal surface is divided into two halves by the spinous process. So the spinous process divides the dorsal surface into two halves or two parts. This is one part and this is the rest of the part. This upper smaller part is called as supraspinous fossa, and this lower larger part is called as infraspinous fossa. Then these two fossae communicate with each other through a notch over here, and this notch is called as spino-glenoid notch. So supraspinous fossa, infraspinous fossa, and supraspinous and infraspinous fossa communicate with each other through a notch called as spinoglenoid notch. And through this spinoglenoid notch, the suprascapular nerve passes. Now let's see the muscle attachments coming in the dorsal surface. So the first muscle is called as supraspinatus. Supraspinatus takes origin from the supraspinous fossa. So the whole of the supraspinous fossa gives origin to supraspinatus muscle. Then next is the infraspinatus muscle. Infraspinatus muscle takes origin from the whole of the infraspinous fossa. Then next is the teres minor. Teres minor muscle also takes origin. It takes origin from the upper 2/3 of the lateral border. So here is the lateral border. Upper 2/3 of the lateral border gives origin to teres minor muscle. Next is the teres major muscle. Teres major muscle takes origin from below the attachment of teres minor. That is this much part, that is the lower 1/3 part of the lateral border. Exactly a oval part below the attachment of the teres minor in the lateral border. So teres major takes origin from this part, that is an oval part below the attachment of teres minor near the lateral border. Now next is the latissimus dorsi. Next muscle is the latissimus dorsi. Latissimus dorsi takes origin from the dorsal surface of inferior angle. So here is the inferior angle. So inferior angle and the dorsal surface part of the inferior angle. So here a small part gives origin to the muscle latissimus dorsi. So latissimus dorsi consists of another origin also, that is from iliac crest, and then again few origin from lumbar fascia and from the T7 to T12 spines and from the lower 4 ribs. So one among the origin of latissimus dorsi is from the dorsal surface of the inferior angle of the scapula. Now that we have finished the surfaces, let's see the borders of scapula. So there are 3 borders: the lateral border, the medial border and the upper border. So first of all we'll see the lateral border. So here comes the lateral border, and lateral border, it is the thickest of all the 3 borders, and it extends from the lower part of glenoid cavity to the inferior angle. So the extent of lateral border is from the lower part of glenoid cavity to the inferior angle. Then below the glenoid cavity there is a rough raised triangular area, and this is called as infraglenoid tubercle. So infraglenoid tubercle is a rough raised triangular area below the glenoid cavity. So that is one feature of the lateral border. Now let's see the muscle attachments coming in the lateral border. So first of all, teres minor. Teres minor muscle takes origin from the upper 2/3 of the lateral border. Teres minor muscle takes origin from the upper 2/3 of the lateral border. Then teres major muscle takes origin from the lower 1/3 of the lateral border, that we have already discussed these 2 muscles in the dorsal surface. Then the third muscle is the triceps brachii. The triceps brachii, the long head of triceps brachii, takes origin from the infraglenoid tubercle over here. So infraglenoid tubercle gives origin to the long head of triceps brachii muscle. Next is about the medial border. So here comes the medial border of scapula, and it is the longest of all the 3 borders. It extends from the superior angle to the inferior angle. So the medial border extends starting from the superior angle down here, all the way down here till the inferior angle. Now let's see the muscle attachments coming in the medial border. Medial border gives insertion to the muscle rhomboideus minor. Rhomboideus minor gets inserted to the medial border opposite the root of spine. So here is the spine or the spinous process, and here comes the root of spine where the spine is attached to the dorsal surface, and there is a small area near the root of spine, that is this small area near the root of spine. It gives insertion to the muscle rhomboideus minor. And next muscle is the rhomboideus major. Rhomboideus major muscle, it gets inserted between the spine and the inferior angle. So this much part, it gives insertion to rhomboideus major muscle. Next is about the upper border. So here comes the upper border. Upper border is the thinnest and shortest of all borders. You can see it is the shortest when compared to the other two borders. And it starts from the superior angle and it extends laterally till a notch over here, and this notch is called suprascapular notch. Upper border starts from the superior angle. It extends laterally till the suprascapular notch. So the suprascapular notch, it is more obvious in this bone. So here is the suprascapular notch, and this suprascapular notch is converted into a foramen by a ligament which connects here, and this foramen is called as suprascapular foramen. This suprascapular foramen transmits suprascapular nerve, suprascapular artery and suprascapular vein. Now we have seen all the surfaces and borders. Let's start with the angles. So there are three angles: inferior angle, superior angle and lateral angle. First of all, let's study about the inferior angle. So here comes the inferior angle. Inferior angle is formed where the lateral border and medial border meet. And inferior angle lies opposite the seventh rib. And about the muscle attachment coming in the inferior angle gives origin to latissimus dorsi from the dorsal surface of the inferior angle. So here comes the origin of latissimus dorsi. We have already seen this in the dorsal surface attachments. Then next is about the superior angle. So here comes the superior angle. Superior angle lies at the junction of upper border and medial border. So superior angle lies at the point where the upper border and the medial borders meet. Next is about the lateral angle. So here comes the lateral angle, and lateral angle bears the glenoid cavity, and this glenoid cavity articulates with the head of humerus to form the shoulder joint, and glenoid cavity is also called as the head of scapula, and neck of scapula is the constricted part adjoining the head. And this glenoid cavity, the floor of the glenoid cavity is lined by hyaline articular cartilage, which forms the part of the shoulder joint. Then there is a small tubercle above the glenoid cavity. Here you can see a small rough tubercle present above the glenoid cavity, and this tubercle is called as supraglenoid tubercle. Supraglenoid tubercle. This supraglenoid tubercle, it gives origin to the long head of biceps brachii. This is one very important attachment. Supraglenoid tubercle gives origin to the long head of biceps brachii. Next we are moving on to the processes of scapula. So there are three processes of scapula. One is spinous process or the spine of scapula, then the ACROMION process and the CORACOID process. First, let's see about the spinous process or the spine of scapula. So here is the spinous process. It is a shelf-like projection on the upper part of the dorsal surface of scapula, and the spinous process is triangular in shape. So here you can see the triangular shape. The spinous process is triangular in shape, and spinous process consists of 3 borders and 2 surfaces. So now we are going to see the parts of spinous process. It consists of 3 borders and 2 surfaces. The 3 borders are lateral border, anterior border and posterior border. So once again, holding the bone in anatomical position, the 3 borders of spinous process are the lateral border, the anterior border and the posterior border. And you can notice that the lateral border, it bounds the spinoglenoid notch. So here comes the spinoglenoid notch. The lateral border, it forms the boundary of spinoglenoid notch. Then here comes the anterior border. The anterior border is fused with the dorsal surface. Then here comes the posterior border. Posterior border is also called as the crest of spine, and it is subcutaneous. It can be felt over the skin, and it has got an upper lip and a lower lip. So posterior border is also called a crest of spine, and it is the thickest, and it consists of 2 parts, an upper lip and a lower lip. Then coming to the 2 surfaces of the spinous process, here is one surface and here is the second surface. This surface is the upper surface and this surface is the lower surface. So these are the parts of the spine of scapula. Now let's see the muscle attachments coming in the spine of scapula. The first muscle is the deltoid. So the posterior fibers of deltoid muscle, it takes origin from the lower lip of the crest of spine. So lower lip of crest of spine gives origin to the posterior fibers of deltoid muscle. Then next muscle is the trapezius. So the lower fibers of trapezius muscle gets inserted into the upper lip of the crest of spine. So upper lip of crest of spine gives insertion to the lower fibers of trapezius. Next is the supraspinatus muscle. The supraspinatus muscle takes origin from the upper surface of the spine. So this upper surface of the spine gives origin to the supraspinatus muscle. Next muscle is the infraspinatus muscle. Infraspinatus muscle, same way, it takes origin from the lower surface of the spine. So the lower surface of the spine gives origin to the infraspinatus muscle. Next is about the acromion process. So here is the acromion process. As you can see, it arises from the lateral end of the spine and it projects forwards. So here is the spine of scapula. The acromion process arises from the lateral end of spine and it projects forwards. And it is subcutaneous, that is, it can be felt over the skin, and it overhangs the glenoid cavity. It is present above the glenoid cavity. It overhangs the glenoid cavity. And the acromion process consists of 2 borders, a lateral border and a medial border. So this is the lateral border and here comes the medial border. So holding the bone in anatomical position, this is the acromion process. Acromion process consists of 2 borders. This is the lateral border present laterally, and here is the medial border present medially, and this part is called as the tip of acromion process. So lateral border, medial border and tip. Next, let's see the attachments coming in the acromion process. So the first muscle is the deltoid. The deltoid muscle, the middle fibers of deltoid muscle takes origin from the lateral border and the tip of acromion process. So lateral border and tip gives origin to deltoid muscle. Next muscle is the trapezius. Trapezius muscle, it gets inserted to the medial border. So medial border gives insertion to the trapezius muscle. Next, let's see about the third process, that is the coracoid process. So here comes the coracoid process. The coracoid process arises from the upper part of the glenoid cavity. It arises from the upper part of glenoid cavity. Here you can see this is the origin. It arises from the upper part of the glenoid cavity or the head of scapula. Glenoid cavity is also called as the head of scapula. And the coracoid process consists of two parts, an ascending part and a horizontal part. So this is the ascending part, this much is the ascending part, and this is the horizontal part. So as you can see, this part is seen ascending upwards and this part is seen aligned horizontally, and hence the name, it is the ascending part and the horizontal part. So you have to elicit it by holding the bone in anatomical position. Now in the upper surface of the horizontal part, so here is the horizontal part and this is the upper surface of the horizontal part, there is a tubercle called as conoid tubercle. Conoid tubercle is present at the point where the coracoid process changes its direction. At the point where the coracoid process changes its direction from the ascending part to the horizontal part, that is this point. That is, at this point there is a tubercle called as conoid tubercle. I have marked the conoid tubercle over there. Here is the conoid tubercle. So conoid tubercle is present at the point where the coracoid process changes its direction, and on this surface there is another ridge called as trapezoid ridge. Trapezoid ridge extends forwards and laterally from the conoid tubercle. So here I have drawn the trapezoid ridge. Here is the trapezoid ridge. Here is the conoid tubercle. So conoid tubercle is present at the point where the coracoid process changes its direction from the ascending part to the horizontal part, and the trapezoid ridge, it is a ridge which extends forwards and laterally from the conoid tubercle. So these conoid tubercle and trapezoid ridge are two features present in the upper surface of the coracoid process. Now let's see the muscle attachments coming in the coracoid process. So the coracoid process, the first muscle is pectoralis minor. Pectoralis minor muscle gets inserted to the horizontal part of the coracoid process. So this horizontal part of the coracoid process gives insertion to pectoralis minor muscle. Then next muscle is the coracobrachialis muscle and short head of biceps. The coracobrachialis muscle and short head of biceps, they arise as a common tendon from the tip of coracoid process. So this is one very important muscle attachment, that is the tip of coracoid process gives origin to the common tendon of coracobrachialis and short head of biceps. That's all about the bone scapula. I hope you found this video helpful. Thanks for watching.